done this in the afternoon before, and so we were very excited to see who would want to be joining us this early. What are we going to do here today? We're going to be talking about active learning, and so this is the type of learning that we're being encouraged to do in our different shops, where instead of just passive lectures, passive learning, we want people to be doing more active things. The problem is if you didn't get exposed to this when you were in medical school or residency, you may not know how to do this as an educator. We have assembled a group of simulation directors, experts here today who often employ techniques of active learning, and a lot of what we do on shift, and we realize that a lot of the skills that we learn easily translate over into other contexts and can make people better active educators. And so that's what we're going to be working on today. We've got a couple different modules we'll go through. We'll see if all this. Oh, we have no disclosures. We're not that cool yet. Couple little things here. Like I said, we're members of the SAEM Simulation Academy, all of us. Most of us are simulation directors. I'm going to introduce the instructors in the room in just a second. We do have extensive training in experiential learning. A lot of what we do is in the sim lab, but like I said, it translates over. So you have a lot of facilitators with you as people come in, as I assume that we'll have more people kind of in the morning coming in based on the registration numbers. We'll be spacing out the facilitators kind of within your group, so they are going to help you to help apply what we're teaching you to what you are doing. And we're going to be working on improving those skills for like small groups, interactive lectures, role plays. These are the types of things that I think, when not done well, are very awkward. And I mean, I'm not really a big fan of sitting there and having a role play with somebody, but if you do this correctly, if you use some of the techniques we're telling you, you can make it a lot more engaging. And we want to also give you the opportunity to practice some of these new skills, so we have a lot of activities to share with you guys today, so you can be applying those skills. Now, we want you to be applying those skills for something that's going to be very helpful for you. So, if you have an upcoming class, something you're going to teach, or maybe it's just the next shift that you're going to work with a certain type of learner, I want you to keep that in mind. And then we're going to be applying what we are learning today to that upcoming educational activity. And that way you really leave here with a bit of a head start on maybe changing that to an active learning activity or some good ideas for the next shift. Okay, like I said, we're going to have about 5 modules, and there's going to be some breaks in between, but at the same time, we're all emergency medicine people. I cannot sit down for a long period of time. I know that there's other people in here that can't. So if you need to stand, stretch, do jumping jacks, walk around the room, it doesn't bother any of us. We're used to being in the simulation lab where many of our co-teachers and things are walking around all the time and very active. So feel free to take pictures, have your laptops out, take a break, and then again, there's a lot of facilitators here, so if you even just want to have some side discussions about things that are really bothering you, we really encourage you to do that. We want you to get out of it what you want to get out of it and leave here with something valuable that's going to help you at your work. We believe you guys are intelligent, capable, care about doing your best, and want to improve, okay? So this is how we think when people are asking questions. I attribute this to Jenny Rudolph. This is our psychological statement, safety statement that we'll be touching on a little bit later. Okay, we all learn from sharing experiences, but just remember that EM, if you haven't figured it out, is a very small community. So if you're using people as an example of a good, or like as a good example, we love sharing each other's names and highlighting when people do well. Just remember that if you have a colleague or somebody that you want to use as a not so great example, please don't share those names. It is a small community. Things get back to people, and you don't want to, have somebody judged for what might have been their worst day when they're not here to defend themselves. You're not being evaluated in any way, shape, or form, so this is for you. Just have fun. Any questions before we get started? No. Okay, I would like to take a moment so that you know who are the facilitators in the room. So my facilitators, which are a lot of you right now in the room, please stand up. Yay! So we're going to go around. So these are your experts today that you're going to be looking to. I'm going to have everybody briefly introduce themselves, where you work, and also what your role is in education at your shop. I'll start with Ms. Stephanie.
Excellent. I'm Steph Stapleton. I work at Boston Medical Center at Boston University. I'm director of EM simulation.
I'm Dr. Eckerman from Loyola in Chicago. I'm the simulation director for the EM residency program of the Sim Fellowship as well.
Lars Beatty at the University of Florida. I was program there, but simulations at Cornerstone.
big capture of hard cost laborers with negative assistant submission.
We also had out of the room grabbing some of us coffee, Mike Lamberta, who is also a simulation director at Maimonides. There we go. Okay, so a lot of sim directors here, so thank you guys. You can sit down now. So a lot of simulation directors, a lot of people that work in education, doing the work every single day. So great people as resources as we go through. Okay, so if we have no questions, I want to get to, oh, hello. What are people? So if we have no more questions, I want to get to one of the first topics that's really, really important called pre-briefing. Pre-briefing and psychological safety are kind of hand in hand. Who here, when I say psychological safety, who feels very comfortable with that term and what it means? Got a couple people here. Okay. Okay, so psychological safety is a term I hear used a lot, and I hear it used a little bit, it's often a little bit tweaked. Many talks I go to, people say, this is a safe space. And I think to myself, wow, I've never felt safe when anybody has told me I'm in a safe space. So, you know, that I want you to get you guys out of the habit of doing something like that. And we're going to talk about how to actually center psychological safety without just telling people that they're in a safe space. I'm sorry, this is a bit far away from all of us, but hopefully you can see it. So I want to first get into what psychological safety is. So what is psychological safety? And I take this definition from Amy Edmondson. If you're interested in this, her books are phenomenal. The most recent, Fearless Organization, is where I get this definition. It's the belief that the work environment is safe for interpersonal risk-taking. So in medicine, the interpersonal risk-taking could be things like having somebody judge you as being a good or a bad doctor because you ask a silly question. So there's that idea that I don't want to speak up because something negative is going to happen, something interpersonal, professional is negative is going to happen to me. When you have these VUCA organizations, volatile, uncertain, complex, ambiguous, I think that describes the emergency department, Amy Edmondson's work outlines that you have better learning and performance, increased engagement, and earlier detection of failures when you have high psychological safety environments. And this has been tested in business, in aviation, also in medicine, and her work in ICUs is actually in that most recent book. So, sometimes people say, well, psychological safety is just coddling, there's snowflakes, they're gonna melt, I have to walk on eggshells around them. That's not what it is. If you see here, that comfort zone that people are talking about, oh, I'm going to make people psychologically safe and then they're going to just feel all comfortable and apathetic. That is if you pair low performance standards with high psychological safety. I would argue that in the emergency department we have very high performance standards. So if you have high performance standards, high consequences, and low psychological safety, that's when people are very anxious. And that's when we don't want our learners to be. We know that that's not good for them. So you want them in a high performance standard, meaning you're telling them what you want, you tell them what you want them to achieve, very high standards, also pairing that with psychological safety. So how do you do that? Oh, yeah, be happy. Okay, oh, and this is going back to my, please don't say these. So, and again, every single time I hear somebody say, you're in a safe space, I'm like, that has never convinced me of that. Remember that our learners are very smart. They know that we're judging them, but we are judging them for good reason. We're judging them because we have experience and we're supposed to be making judgments and evaluations of our learners. So they have to trust in that. They know they're being judged. They are so judging you while you're talking. So when you're like, this is a safe space, no judgment, they're like sitting there judging you right then, and they know that it's a lie. And then they have prior experience of retaliation after they're vulnerable. So everybody's carrying these things with them. So how do you make them feel as safe as possible? Oh, and then for those of you that are, we talk about the experiential learning cycle a lot in simulation. For those of you unfamiliar, in simulation, we're simulating an experience. We want you to have an experience. Then you reflect on that experience and kind of reconceptualize and reconceptualize how you want to approach it different. And then you're going to experiment new ways of approaching. This means that you have to be comfortable reflecting, being critical, and admitting that you're wrong. And then having that moment to reconceptualize and re-experiment with new ways that, again, might not be exactly right. This is why you need that psychological safety, so you can really engage in this experiential learning. And I think we can all, at least I can, think about times in your medical learning where you didn't feel exactly safe, and then when you went to go engage in that clinical area or you went to engage in a group discussion, once you kind of get burned, you don't really want to engage too much again because you're worried about how people are going to perceive you. You're worried that maybe you're not going to be asked to be on that next research project, or maybe you're not going to be asked to do the chest tube the next time it's in front of you. So when you opt out of that experiential learning, that's when a lot of damage can happen to your learner. So pre-briefing. Pre-briefing is one of those ways that you're going to build a scaffold of safety for your learners, and you start at the beginning, pre-briefing. So what is a pre-brief? It's a minute or two at the start of whatever you're doing. Often in simulation, we will start with a pre-brief. It takes about a minute or two, and there's different categories of things that you move through. We're going to actually have in the workbook, we're going to have the first activity is going to be to get you guys thinking about how you want to script your own pre-brief. You can pre-brief before a shift. Many of us have modified pre-briefs that we do before shift. It takes a minute. And I even do these before small groups. If we're discussing an article, I have a pre-brief set for them. So it sets the stage, it includes rules and reminders. It's really kind of a shared contract that everybody learning together, and active learning. This is why we make you guys sit together, like you're going to be learning together. It kind of gets everybody on the same page, gives them a bit of a contract on how to work together. It promotes that psychological safety, gets them on the same page. Also just tells people where the bathrooms are. You know, everybody's more comfortable when they know like where the coffee and the bathrooms are, which is why I was in a panic this morning because there was no bathroom. Okay, elements of a pre-brief. So these are in the workbook. If you turn to the first page, we've got a little space there for you to think about an upcoming educational activity. But then, or the first activity, but then we have a pre-brief script there with many different things for you to start thinking about. And I'm going to move through these categories. So start looking at these and think about your upcoming activity and maybe some of the statements that might be useful for you. So first of all, centering psychological safety. I use the basic assumption. This is, was developed by Jenny Rudolph at the Center for Medical Simulation. So I definitely credit her, but I say this to my residents. Every time I start saying this, they can finish it for me. They know it. We believe that you're intelligent, capable, care about doing your best, and want to improve. I love this statement because it doesn't say you're right. It doesn't say you're wrong. It doesn't say you're struggling or not. You're intelligent, you're capable, you care. I think that caring is really important for people, and you want to improve. And I tell people, not only do I hold this about you, but I want you to hold it about me, because I'm going to mess up too, and I'm going to hopefully receive that feedback with grace and try to move forward from it, just like I want my learners to. So, centering psychological safety. This is also at the beginning, if there are sensitive topics or trigger warnings, remember you do not know, people are not coming at you like an empty glass. They're full of a rainbow of different things that you are going to encounter that you don't even know are there. So this is why it's good to do those sensitive topic trigger warnings, because we do talk about a lot of things that are sensitive in emergency medicine, and you need to give people a heads up that's coming again, so they're not blindsided, so they feel safe. This also just communicates a respect for the learner perspective. You're telling people, I respect where you're coming from, and I think that gets people to engage with you. Two, the second element as part of a pre-brief is confidentiality. Expectations for learner confidentiality. In the sim lab, many times we have to say like, hey, we put a lot of work into this, so please don't go telling everybody because we want it to be a surprise for your friends as well. Instructor confidentiality, that's also, if I'll tell some of my learners, if it's a formative environment and they're not being evaluated in any way, shape, or form, it's just for them, I tell them that, like, I will not be breaking confidentiality. I usually joke, like, you have to take this chair and throw it through that window for me to tell the program director anything. So again, they know exactly what those bounds of confidentiality are going to be. Logistics. What's going to happen? How's it going to happen? What are the rules? What are the bathrooms? Or where are the bathrooms? That sort of stuff. You can just touch on it there. And then this is a very important element for simulation. I include it so that you can recognize it and use it where it's needed. But if you're doing this on shift, the fiction contract is for anything, again, active learning, role playing, simulating, thinking scenarios. The fiction contract acknowledges the fakeness of it and says, hey, however you play this, whatever construction paper game we've got right here, that's not going to reflect your clinical performance. We're just going to use it as a platform to learn and discuss things. Well, then people are going to engage with the game. They're not going to be like, oh, if I don't use that construction paper right, she's going to think I can't innovate. They're not going to do that. So it acknowledges the fakeness. We have many different ways. So if I do an escape room or whatever, I'm asking people like, hey, please just engage with the game. We're going to use it as a platform for discussion. In On shift though, it's not fake. So remember, that is when you get to see the fiction contracts, because it isn't fake, and you are going to be evaluating your clinical performance, so you can skip it then. Okay. We went over some of those psychological safety elements. I want to take 10 minutes now and have you guys start thinking about an activity and start going through that script and thinking out maybe language. We have a lot of example language for you to use. And then there's some space that you can think of your own language, and our facilitators are here to help you. So if you just want to kind of take a minute at your table and maybe go around and say what type of educational activity you are thinking of developing, and then our facilitators can kind of help you build a recruiter for that. Okay, so I'll let you know in about 10 minutes has passed. Thank you so much.
Yeah.
Yeah, I didn't think about registration. I'm just honestly. Oh yeah, so what we were thinking was just kind of think about what activity you want to plan for, and then we don't necessarily need to share this description, but we're going to kind of help you develop it just as a to give it a try. So if you guys have anything coming up, so like what, who do you have to teach about?
Share. Lars,
Yeah. Okay, so probably slides, pieces, and things like that. Okay. So is it like a sit down with a couple people and discuss things? Okay, so that's perfect. Yes, yeah. Okay. What do you think about building?
some of the
Well, you're the potion. I said deep, we're going to talk about that. That's actually Charles' decision. Yeah. We'll be talking about that, how to start this conversation. Take care of us. My simulation brain is like, I couldn't get all this in the case. And what are you working on?
So on disaster medicine, and we're going to institute scholarly modules for the residents. So 6 hours a year, and it builds year to year. So let's start. The first module is so I want to develop a module for 20 minutes didactic, 20 minutes of adult.
Okay, yeah, we'll definitely try to assist you in any way we can with that. So it is in person? Yeah, okay. Okay, incident management. Well, I mean, this is, so these are learners that they're not going to have a lot of experience with it, right?
Well, one's,
just a language thing.
Problem, yeah.
and the other one,
Yeah. Okay, so there's like 3 learners.
there's It's building P drop 1, 2, 3.
Okay.
The P drop 1 has been established. It was looking for life. The 1 is going to be 2, it's in the military. 2 is going to be 3.
Okay.
These sorts of areas are like,
Okay. Yeah, no, I've seen a lot of like. Yeah. I'm sure one day that you have the aspects. So everybody that's
one of the guidelines is safety. Too much.
When you like,
For the residents in there, anecdotes or something,
Well,
I also use that bunch of lockbox in the city, so eventually, so they want to hear worship, so that actually that so we have longer stays. And they're all this where, you know, if you're not
screaming. Yeah.
So short budget, exercise plan.
So I'm gonna be throwing
You need it, child. Is that what you're saying? Yeah.
So that's, so we're developing guidelines, we're doing a Delphi study.
talking about how I don't have an expectation of them to think as a word, so it's gonna be a shift in the framework.
Oh, yeah, that,
Why your simulation is, your simulation.
Let's reframe everything all day about myself, and this is what I want to do.
Which kind of led to the idea of how we're developing instead of one of the challenges providing
Yeah, I think there's a way to do that too. Yeah.
procedures, to write procedure, which we have already, but also
I love the conversations happening. To a module on learning objectives. And I know that you are probably thinking to yourself, oh no, this is always the very boring part of learning about education. But it took me a little while to realize how important learning objectives were. I've actually been on a few different projects where, big education projects where people just seem lost, and I come in and I say, can I see a list of your learning objectives? And then there's a blank stare and I'm like, oh, this is where we went wrong. So learning objectives, super important. They communicate what you're going to be covering. They tell your learners what you're going to be covering. And we're just going to spend a couple minutes talking about why they are so important, and then giving you some guidance on how to write these well, because learning objectives are half of the work of preparing like a small group for me, really picking which ones are going to be good. So we've got Stephanie up here that's going to talk to you about that.
Yes, indeed. Steph Stapleton, Boston Medical, Boston University. So I'm going to talk briefly. More?
A little bit, yeah.
Okay. I'm going to talk about learning objectives. And I'm sorry, guys. I have like a cold or allergies, and the plane has killed my ears. So if I talk too quiet or too loud, just give me the like amp it up or lower it down sort of signal. So yes, I just want to, I actually love learning objectives. I don't think they're boring, but that's okay, to each their own. But they're a key part of sort of planning any educational event. And you'll find yourself keep going back to them and keep sort of drilling down, so to speak, to make sure everything actually aligns. So if something doesn't, go back to that and it'll help you figure it out. Disclosures, once again, nothing. So to be clear, today's goals are to define a clear learning objective, correlate learning objective in Bloom's taxonomy, identify differences in learner versus obstructor or instructor given objectives, practice using the steps of writing learning objectives, and use these concepts to improve your learning objectives. That'll probably be more applied in the future. So what is a learning objective? Have you guys all heard of the SMART goals, SMART objectives? Okay. Me too, although I have to say I can never remember what they all stand for, but I think this is actually really important. So it's specific, it's measurable, it's achievable, it's relevant, it's time-based. And we'll go through an example at the end so we can see why this is so important. But let me actually move one up here. So for example, I'll say I'm going to plan a day where the residents practice central lines. Okay, what does that mean? I can think of a million different ways to do that. Does it mean that they're going to start from consenting the patient and go through like starting the pressors? Does it mean that we have to look at the sterile dressing and make sure they're like sterile gowning and everything? Does it mean that they're just going to be focusing on actual like ultrasound identification through like port flushing? Where is it? And what are the key elements that we're really looking at there? So you can see even with that brief example how different it can be. So clear focus, clear direction for educators, for learners, for guiding the curriculum, for guiding the instruction, for guiding the assessment. Every case, every curriculum has to have this, because otherwise your facilitators will kind of go off, and sometimes they'll do it anyway, but they'll kind of go off a little bit, and this will actually help you find something more cohesive. So let's talk about specific. What does that actually mean? So you want to clearly identify the core like knowledge, the skill, the behavior that you want them to demonstrate. So central lines, I want them to insert one central line from identification of the vein on the model through port flushing. Okay, that's fairly specific. Measurable, it specifies the criteria for assessing whether or not the objective has been achieved. So it doesn't have to be a 20-point checklist. It just needs to be clear that like those are the key actions I want to see. It has to be achievable. So if I set this goal, and let's say it's going to be interns who never put in a line before, and I say we're going to do this in 10 minutes, like that's hilarious. Okay, it's never going to happen because they need a lot more coaching, et cetera. Relevant. So again, if you have people do a procedural session on central lines with people who don't actually place them and aren't interested in that, like everyone is just wasting their time. And then tie bound, I sort of skipped ahead because this is really what will be guiding you towards everything, right? Because you have to acknowledge what time, what materials you have, and if you don't plan for that, you'll find yourself just running along and everyone will be a little bit frustrated. So again, with the central line placement, I want them to demonstrate the ultrasound, finding the vein through port flushing within this half an hour session. Does that make sense? Great. So why is this important? There's a few different perspectives here. So there's teacher perspective, there's institutional perspective, and then of course there is actual learner perspective, which we'll go into on a later slide. So clear communication of goals, right? It's important that all members realize what the goals are, and they will use that to actually guide the education that they're hoping to provide or learn, and that it aligns with institutional perspectives. So I can give you a funny example, same thing with guidance for curriculum development, et cetera. So as an example of what not to do, I was trying, and this is my own example, so I can share it. Recently, an interest of mine is mechanical ventilation in the ED. I'm sure as many academic centers, the RTs, like own the vent and basically will not let any ED doc even consider like touching it or even consider doing an educational section, letting them touch it or anything like that. And to me, I understand that they want to own it in an academic center, but considering most of us will go, and most of our residents will go into the community where you're actually responsible for that, I think it's a gap that should be addressed, but it's hard to figure out exactly how to do it. So I tried in my very mid-career sneaky way to be like, can we just get can we get a vent in here? We're going to do some teaching with the faculty, and a lot of them moonlight in different places, so it would be great if they sort of had that understanding. No, dude, the RT's cut that down because it doesn't align with institutional perspective, right? That's not the role. So, which in retrospect, I kind of knew I was pushing it a bit, but here we are. So same thing, focus and direction for the learners. You want to be able to plan the curriculum, deploy the curriculum, assess the curriculum, and then make sure that everything is actually applying to your educational standards and whatnot. So for example, with mechanical ventilation, if I go through and plan some crazy curriculum that only advanced SICU and ICU and neural crit docs are talking about that doesn't really apply for us, then people are just going to glaze over, like I sort of did myself for a minute. Versus really understanding the first initial event settings. Any questions on that? No. So thinking a little bit about Bloom's taxonomy. Has everyone heard of Bloom's? Yeah, okay, great. It cracks me up that we can't even decide, should the triangle be upside down or right side up, and which one is which? I don't know. But the gist is that essentially you go from the less, this gives us a framework for understanding from the least sort of integrative and least complex to the more complex and integrated method of learning, applying, evaluating, and creating. So I can give you, and you'll come back to this again and again because it'll help you kind of separate out what part of this are you really looking at. Do you just want them to remember something? Do you want them to actually be able to apply it? Generally, we want it to be able to apply. Do you want them to actually go through and evaluate the information and create, et cetera? So, and this can be, it's not always per their experience, right? It might be the medical student is learning something advanced for their level, and they can go in and actually create, if it's an MS3, they can go through and create something for an MS1, et cetera. The other thing to think about, the example I have from this is I love the idea, how everyone, as we're talking about, often gets anxious in SIM. It's like the spotlight effect. They're right, they are being judged, I'm being judged, everyone's being judged. It's what you do with it that really matters. And so I was I would love to get the anxiety level down, and so they can just focus on their learning. So I was maybe if I take them behind the scenes, and they understand what it's like running the mannequin and being the mock patient and seeing what people do, maybe that'll help decrease the anxiety. And that was my theory, and I just did a really quick survey just to get their feedback. And it turns out they were no, we don't feel anxious, but we love this because it helps us really think about the pathophys and actually analyzing the pathophys and being able to create an understanding rolling through it. So that was actually really interesting to me. It was way above anything I imagined. So this is just talking a little bit about instructor versus learner-driven objectives, and actually that was probably a good point of this. So my focus was on sort of broader teaching goals and decreasing the anxiety with the side of pathophys and being able to make the, run the room, et cetera, and actually make the decisions, which is so hard to do as a med student. And then, I was focusing on using SIMFRD, et cetera, and kind of broad. And the learners clearly had their own objectives coming out of that, right? They wanted to think more about the pathophys and understand that and be able to recognize and make decisions based on that. And to them, being able to make those in the moment decisions was a key part of that. So I think this is sort of encapsulating what we've been talking about in a lot of ways. Instructor, learner, everyone has their own framework for understanding things. And I think it's important that we also kind of acknowledge that internal framework. Because if I have something I think is important for the learner to learn, for whatever reason, even if it's valid, if they don't see it as valid, if they don't see it as valuable, if they don't see it as legitimate, and they think it's going to totally decimate their internal framework and not be useful, then like they may not end up really absorbing that or engaging with that whatsoever. So thinking about how does it align with all these different elements is key. All right, and then so the steps of writing through a learning objective. So you're going to actually write each objective. You'll complete the phase. After participating in the session, the attendee should be able to, and then you want to choose your verb, which is important. It's an actual verb. So to identify the ultrasound, to identify vein with ultrasound within 10 seconds of the probe or something like that. That's a very specific one, but I'd love to really gear down towards those. And then you're going to review each objective to make sure it is an actual outcome. And that's the really key part. Like if you get nothing else from this, make sure it's specific. Make sure it's observable in some way, because otherwise you're not going to know if you met it or not, and you're not going to be able to tweak future things. You're not going to be able to assess anything. And it doesn't matter if it's a paper, if it's a formal assessment, or if it's you just being like, did this case run the way I thought they would, and they would get X, Y, and Z from it or not? So you have to be able to do that. And I think of it more and more like as at the end of some learning, I expect them to be able to do something or to exhibit something, right? Ideally, there'll be some sort of even micro behavior change or concept change, knowledge change. All right, so we're going to go through a couple examples here. So I think, and we listed this as like a poorly defined learning objective, which it is, but I almost think this is sort of like with Kearns, there's the general needs assessment, and then there's the really specific one, right? So the general learning objective is that learners should be able to understand the management of DKA. But okay, that's great, but what part of DKA? Is it that you want them to be able to say, oh, DKA is due to diabetes, and you have to give them lots of fluids and like insulin, and they go to the ICU in some places. Okay, cool. But what specifically about this? So more explicitly defined. So at the end of the simulation, participants will be able to recognize DKA symptoms, and you could even drill this down a little bit more by saying, oh, I want them to talk out loud and say, I recognize this person is really tachypnic, and they're belly pain, and they're diabetic, they're at risk for DKA. That may be a bit much, but you can. Obtain vital signs and a VBG, key elements, right? VBG especially for DKA, vital signs for other alternative symptoms and diagnoses. And then institute treatment with IV fluids, IV insulin, and potassium replacement like as needed. Question in the back.
Well, I was going to say, so I think this is an amazing slide because it really shows when you're an educator and you are looking at somebody else, you go on Meta portal and you're looking at somebody else's learning objectives. I don't want to read the whole education thing that they have, but you can see that if you read the one in the green box, you're like, okay, I wonder what that means. But if you read the one in the blue box, I'm like, oh, this is either perfect for my PGY1s or this isn't what I'm looking for my PGY4s. You see how important the difference is then for you just like looking through things. But also when I have like my program director says, what are you doing to teach DKA in the simulation thing? I give them this. Boom, this is exactly what we're doing. And I might even have like, oh, for the PGY1s it's this, but for the 4s they discuss the differences between insulin administration, different types at the literature level. So this very clearly communicates what you're doing. So that's why there's a subtle difference, but it's so important once you start writing these educational pieces.
Yes, and this will actually help you write your case or your small group or whatever else, because if you, for example, I'm Sim, so I think in cases, if I write a case about DKA symptoms, but we don't even get to the treatment part, like, then I haven't even met half my goals there, and what are we actually doing here? So I think that's it. Yes, references, so now everybody gets a chance to do their own.
Yes, we have the SMART, in case you couldn't see the slide, we've got that little SMART mnemonic there that a lot of people use, but also on the other side, we have from AAMC, I think.
Yep.
They have instructions on how to write learning objectives. It is two-sided. excited, so I welcome you to look in the back as well. I believe it has some Bloom's taxonomy stuff on there and some tips and tricks. So start thinking about learning objectives and how you're going to make these specific to really communicate what you want to do in whatever educational thing you're going to teach. You're going to find that when you spend time on learning objectives, you become very specific about what you're going to teach. It also allows you then to not overburden your learners, and you can really circle around things really reinforcing what you want to get across. I just want to say one thing. We talked about learner-driven objectives here, and that was a concept that was a little tricky for me to get. And so I like to just kind of summarize it by saying, you don't know what the learner-driven objectives are because you don't know what your learners are coming and actually want to learn, right? Just like we have things we're going to teach you here today, but we have you guys sit and we try to get to know you a bit because we don't know what you guys are looking to learn. So in everything that we've designed, you have to hold space when you have adult learners with all this great experience. You have to hold space to talk about whatever they want to talk about. Because if you don't talk about what they want to talk about, they're not going to listen to you. And they're going to be thinking about what they want to talk about the whole time. I'll give you an example in SIM. We could be doing this DKA SIM, and let's say there's like some red herring that comes in at like a communication issue or a difficult consultant or something. Maybe everybody in that room is like, you know what, I really want to talk about how to talk to a difficult consultant. And you're like, but I'm going to talk about DKA. They're not going to listen to you. They want to learn about the difficult consultants. You have to hold space for the learner-driven objectives. That means that you don't have to write them, but don't overburden your educational activity with your objectives because you will need to address theirs. So I usually think about 70% I write, and then the other 30% are going to be what they bring. Any other thoughts about learner-driven or no?
Good point.
Okay, so think about those as well, but I didn't want you to think, ooh, how do I write a learner-driven? That you leave to them, and usually we figure it out by saying after SIM, well, how did that go? Like, what do you guys want to talk about? And then they tell us all these things, and we say, oh, some of these are what we're going to cover, some of these I wasn't planning on it, so you hold space for that.
Can I just say one thing, actually?
Yeah.
You have this golden moment right at the end of the sim, and they will like auto-debrief themselves.
Yeah.
So I'm always eavesdropping on that. And I just learn a ton. It's actually some of the best conversation I hear. And it changes when you walk in the room, no matter what you do, because you're introducing a new element.
Those of you that don't teach SIM, she's talking about the second the case ends until the people are walking into the debrief room. The simulation educator is listening to every single thing that they say because that is going to frame your debrief. When everybody's just like, oh, that was hard, or blah, 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 we're listening to all of that. And a lot of times the learner-driven objectives are in there.
Yeah, or like, wait, I really struggled with, like, I just did a neonatal recess one, and they were like, wait, how do I actually, if I'm one person, how do I bag, and how do I CPR? And they were like, let me actually figure it out. And they were like troubleshooting and figuring it out. Like that is golden. That is amazing.
Great learning. Yeah. Okay, so again, try with trying a couple learning objectives. They can be a little bit tricky. We're here to help you.
Do you want it on this slide or a different slide?
Oh yeah, I was supposed to be certain about
make sure that I can show something that makes it sharper and I see how they're like, I always like to say, next to the paper, so this stuff means like, everything is like, different times, right? That's what we need, just like, everything is full section. So let's see, and we have to take a portion of the piece there, and actually
I remember thinking, man, this is just I can't believe it.
a year-long kind of show thing, right? And so just like this,
It's very dynamic. You have to also create so you have this sort of or like you mentioned, foundation across it, we know. So rather than have experience across and like so probably the main like older just when it comes to procedural training, so you know, like
yeah, I guess it's education finals.
and
In terms of simulated,
The learning.
I understand where breaking it all
person
down.
likely seen the procedure, may or may not have done the procedure, whether that's that conversation, that level of detail, is a very different conversation. Showing a resume.
And not putting yourself in the
been like that since APR. Trauma and critical area. One thing that I did was these hours to track yourself.
Communication skills. So facilitation and communication, what does that mean? Simulation educators are often very intentionally communicating and setting the stage for whatever learning is going to happen. And we actually use fairly specific language that we're going to be teaching you guys today. And this is how you might think, okay, if you want a small group, when I used to go to small groups, I used to have a list of questions, maybe 10 questions that the instructor would give me, and I would be super bored as we just went down one question after another. How do you avoid that? How do you actually get your table talking about whatever topic it is you want to get them talking about? So we're going to talk about how to engage everybody at the table, how to get them talking even when it's 7 a.m. and it's very difficult and nobody wants to, you know, be at a conference or whatever. Oh, that example was way too forefront in my mind. Educating everybody, engaging everybody, keeping the discussion on track. Because if you don't know exactly what you're talking about, the discussion is going to veer off into, again, those learner-driven objectives. Communication challenges, and we're going to give you some time to practice some of these new skills. So first of all, how do you get people talking? So how do you get people talking? Making sure everybody talks. We're going to talk about setting the stage, encouraging conversation, and using your silence strategically. So, first of all, setting the stage. This is where that pre-brief comes in. The pre-brief is great. It's a place that you get to start. You talk for a minute or two. It gets everybody warmed up and listening to you. It gets everybody to kind of agree on what the rules of the road are going to be for the day. You want to, though, be modeling. Even when you start this, you want to be modeling your curiosity, your interest, and finding what's exciting and relevant. So you, with your demeanor and your mindset, are going to be modeling what you want from your learners. There is a toolkit here. It is in your packet. You have it in table form. We also have cards because you're going to be playing a game with this. These are, I think of these as like your moves in a conversation. So you guys are all circled up sitting together. And we're going to have an opportunity for you guys to try to engage everybody at the table in a conversation. But whoever's facilitating is going to use these tools, these moves. And this is what simulation educators do to get people to continue exploring and get people to continue talking. And when you do this right, it can look very subtle and it looks like you're not driving a conversation, but you are. So these are the different moves that you can do. These are from the Center for Medical Simulation. They allowed us to teach and publish these, generally well known in the sim community. So I'm going to start with clarify. And these are all just things that when you're at a table and maybe the conversation dies down or you want to move it in a direction, these are the different moves that you can do. So clarify. Clarify means that you're going to get more information about something. So you're talking about, let's say, chest pain. Clarify is more information. So let's say Charles, we're talking about chest pain. Charles brings up like, oh, I took care of like 10 chest pain patients yesterday. So now I want to clarify a little bit. So I might say to Charles, because I want to get him talking, like, tell us like what kind of cases did you have? So I'm digging in and getting more information. This allows other people to be on the same page as Charles and to potentially have thoughts based on what Charles is saying as he digs into his exciting work experiences. We like to acknowledge a lot what people say. Like, I've heard you say this. Can you tell me more about that? When you kind of pick somebody out like that and you really highlight what they're saying, it also will get them to want to continue to participate, continue to be involved. So that's clarifying. Digging. Digging is to clarify is to get more information about something. Digging is to really encourage reflection. And we have examples on your table there, but some of the examples I have up here. Tell me what challenged you about that experience. Tell me, like, you know, if I'm talking to Charles about his 10 chest pain patients and I kind of want to get into, like, what it feels like to be overwhelmed with 10 chest pain patients, I might be like, tell me a little bit more about that. Dig into that experience a little bit more. What lessons did you learn? Did that help you with other similar experiences? So this is digging in and encouraging reflection. Sharing, asking for other people's input. So Charles and I talked a little bit now, but I want to get other people at the table talking so I can say, who else experienced this? Anybody else see a bunch of chest pain patients? And then other people, again, on the same page, they're thinking about the chest pain, they'll start sharing. Generalizing relates the point to a broader topic, and so this is one in sim will many times say, like, what lessons can we take? We might have a discussion about talking with a difficult consultant, and we can say, okay, so what lessons are we going to take from this to our next shift? You get people to reinforce the points that you brought up. Again, it really driving conversation around your learning objectives. So generalizing gets them to relate it to the clinical area, and that's very important in active and adult learning where you have a lot of tabletop games. I sometimes have played very fun tabletop games and then wondered what I was supposed to learn from it. So these are the types of things where you get people to relate it to what are you supposed to learn from an activity and bring it into our work in the clinical area. And then lastly, teaching. Every learning objective you should have at least a little, if you're not in the learning objectives, we had like a DKA event. And so maybe if I wanted to talk about like potassium repletion and DKA, I have that queued up in my mind and ready to go. A little 3-minute presentation where I'll say, I won't take 3 minutes to talk about potassium repletion. However, you can also skip this. If somebody else talked about it, let's say, I'm gonna keep picking on Charles. Let's say Charles talked about potassium repletion. I can just then echo back if that's one of my learning objectives and say like, so Charles brought this up. Again, I'm re-engaging him, I'm reactivating him in the conversation, and getting him maybe to repeat what he said, fill in any little gaps. Well, now I don't need to do the teaching. Charles just did the teaching for me, so I can reinforce what he did. But I always have that teaching ready in my back pocket so that if the learners didn't say anything during the discussion, I can then come up and give them really what we want the correct answer to be. Using silence well. Okay, so allow silence. Many of us have been told to count to 7, which means that if I was to be asking you a question and you guys didn't answer, and I was asking the question, I would finish asking the question, and then in my mind, I'd think 2, 3, 4, 5, 6, 7. It feels like a very long period of time, but it allows people that are in a discussion to think. You don't want somebody to just maybe sometimes say the first thing that they thought of. You want them to get their thoughts together. It allows everybody to kind of sit. And then while I do that, I often will scan the room and kind of make vague eye contact with a lot of people because then they get uncomfortable and they'll start talking. It takes about 7 seconds. So start counting to 7 in your mind. Just have it be a thing. And your learners are going to get into this rhythm where they know that they don't have to jump right in. They don't have to make you happy by talking right away. And then you're going to have these pauses and value their thoughtfulness. Now, what happens if nobody talks? You're like, oh no, I made it to like 10. This is when I usually will take a moment, and this is what I generally do. Why is nobody talking? Is everybody too tired and they need to get up and have a stretch? Do we all need to have a coffee break? Do we need to do something else to get people's minds engaged? Or did I just not ask a good question? So often I'll rephrase the question and say like, oh, I'm sorry, I don't know. Does anybody have any questions about what I was asking? Do you need any clarification? So clarify, restate, and then also sometimes people are just tired, and you can get a lot of goodwill out of people if you just acknowledge that they're tired, and you can tell them, okay, we got 30 more minutes. How are we going to get through this, guys? And you either get them all to invest to get through the activity, or you figure out what type of a break you need before they can come back. So again, using that silence well, and using silence as an indicator about how your learners are doing. Okay, so we're going to practice. At your table, you all have your tables in the packet that have these tools. You also have these helpful cards. So what we're going to have you guys do is one person at the table is going to have these cards up in front of them, and you are going to try to drive an interesting conversation. So you can see the instructions in the little booklet. We have some prompts. And whoever decides to be the facilitator is going to try to, again, just drive an engaging conversation. No goals, just try to make it as interesting as possible. But we want you to start practicing using these tools. And your instructors are going to be able, the facilitators at the table, will help you if you're stuck with how to use these. On the backs of the cards are some of those example statements, just like in your tables. So, we got about 10 minutes for this activity, so start, and after a couple minutes of maybe trying to drive a conversation, feel free to pass to another person so that they can try it out and try using these as conversation drivers.
And it's summer, you guys have been Does he do a lot of different activities?
med school.
Who's that? What's your offering for educational?
So you're taking grants. I always think about like energy margin at the airport because I never know when I'm gonna come and like I start the batch line.
So we haven't decided if we want to do it, do we stay these days? That's smart. I know that's a little bit like your you may remember it's the heritage of the country, and I have addictions diagrams of property, so it's got to be 12 pack. You know, it's not read something like refrigerator, and I have to go like so my main language, like comes very hard. So for me, if I was like, okay, that is part of my makes sense. And as I could, like the US, I do this, and I you do. I'm in the pre-contemplative stage where I recognize that it's a problem. I have to know it's right. Yeah, it's there. I'm sure I have some of it. I was gonna say I actually did get coffee because again, this is hard to sit. I don't know why I didn't see it. You guys thought this was
That is pretty easy talkers, right? So the goal is, people are gonna have to talk, right? Okay, so.
Tell me more. Where are you talking
Plus, you didn't have this.
how do you know that?
You had traffic.
I mean,
So,
You can't go to teach just yet. Okay, no, when you said Haley, now that is great to activate that person. Just remember that now other people feel like they're not, sometimes I disengage with somebody. Then the second thing that you did where you're like, how many people immediately engage in a launch running the table, that was also smart. You have somebody that raises their hand. You can be like, tell me more about that. And then you go on to asking them to just share experience. Yeah. So you see this yes, okay. I take this is not like a linear thing, like no, these are just rules that we have. So if you see a simulation, somebody that's really good at debriefing, if you we'll focus on this module, the structure that you have. We're actually following structure, we're using these questions. It does matter. And the residents of that like they just have a great conversation. Yeah. As opposed to when I thought these were like, this is a great conversation.
yeah, so you plan to go for their next trip.
And
Like it.
next week, and then we get the amateur drivers.
Sit down and two options.
I love Congress. Yeah, it's like, that's where I grew up. The Hilton Head is
Hilton Head is also a fun room. It's a different vibe. I'm from South Carolina, so I got you. We'll talk after. We'll talk offline. But it sounds like you like to try to get
Starbucks here.
where does everyone else prefer now?
I'm learning. I don't know.
What do I like? I like to read the book. I like to see all the things. I like to play. Thank you. And I saw someone with fruit from
Sorry, I don't remember.
Shaker.
Where do you make the
I like
I need to find
when I
that.
travel on Instagram folder on my cell phone that I travel. So coming up, I'm planning a surprise trip for my girlfriend and I to go to Mexico. Just committed to that 3 days ago. During the winter. I'm gonna probably
So we got a couple of benches, so let's see first is on the beach. Who's mountain? Right, who's anywhere that I can get to that's not work?
What vacation?
Dude, it's so easy to know I can't use it. They don't even have the internet right now.
And so I wanted to
Okay, so we started. And you got the answer to me. So, I do like how the, but I think look at that map, and I say, who else, and you got everybody's engaged, which is different. And place to go. What's your so ridiculous, or you're gonna check out, because it's just, okay, well, it's awesome. So, and then the next person was like, oh, I say something. But then you can, you should not create a table. It's the beginning, I know, it's really interesting, and all these places.
Then going.
I would say, even for doing it, so that find those common. Well, I know.
And sometimes we do, they're like, that's one time.
Absolutely. Maybe see what's up, let it just set there, okay? And then you just take your learning objectives and do little like shots. My teach small groups, it's like age rather than lecturettes, that's the other side, lecturettes, little 5-minute cans, stuff like. And they're often the types of things that you don't even have to think about, you teach it all the time. Right? But you balance it and you figure exactly what you want to talk about. And then it's great to get the talk about these things, what we really highlight it, it's not just of course.
Yeah.
Okay, let's see.
I have 4 dogs. So I go around like
Knowing like about it. everybody to be participating, and that participation is really how you succeed in this area. So that pre-brief is really great. Resetting those psychological safety boundaries. Knowing your learning objectives is huge because many of us we've created this little visual representation called the lily pad framework. It's just a visual thing. I don't think you're going to find this anymore. But this is often how many of us are visualizing moving through a small group. So we wanted to share that with you. So the lily pad framework. It is a discussion map for you. This is often, the framework that I'm going to be showing you is often what I have before small groups and a lot of my other active learning educators have for small groups. It's going to keep your objectives clear because they're going to be right in front of you. Each objective we consider like one little lily pad, and you're the little frog that's jumping between them. So it helps you transition smoothly and have your teaching points for each objective. So if I have 5 objectives, I have my little lecturette with the teaching points under each objective. And then I have this roadmap in front of me to keep track of how we discuss these different things and just start taking notes. So, for example, this is maybe what my small group looks like. It's a little simplified version, but let's say I have my 3 little lily pads, and for a little acute coronary syndrome small group, I might say, again, using my objectives that says by the end of this session, learners will be able to list emergency conditions that present with chest pain, discuss the treatment for acute coronary syndrome, and discuss the risks and benefits of Lovenox versus heparin. So let's say this is like a PGY2s that are going through this, right? Know that you don't have to do the objectives in order. Many times I will put the objectives in an order that I think makes sense, but sometimes people are going to move through them in a different way. And allowing, the better you are with these tools, these talking tools that we introduced you to, the more you're going to be able to seamlessly move through these and guide the conversation to make sure you hit all the objectives. But when you're starting, feel free to just go through them in order. So you can see on this first objective, let's say, I'm a little instructor frog, so I'm thinking to myself, I'm gonna start on this first objective. And I might tell people like, okay, so who knows the emergency causes of chest pain? I got a group of PGY2s, I expect them to know this, so I'm not gonna spend a long time on it. So they'll say all the things, I have my list, I make sure we say all of them, and I say, great. So, summarizing, I re-summarize what they said, I can move on from this. We already hit this objective, great. So then I make a little transition over, and I might say, well, one of the things that we discussed was acute coronary syndrome. So I'd like to talk about who has seen acute coronary syndrome, how is it approached in the clinical area. Again, I start asking the questions, start driving conversation around it. People might bring up aspirin, they might bring up heparin, and maybe I have a little lecturette that addresses those things, or emergent PCI. So I make a little transition, I'm on my second objective, I ask that question to activate. People might talk a little bit, and then my little lecturette, I have the AHA guidelines for ACS management in front of me, and I'll just say, okay, we brought up a lot of good things, there is some practice variability, the thing you have to know is the ACS guidelines, and this is how we follow them. Again, very clear about what they're going to take home from that. But they've connected it to what they learned, and highlighted, maybe they're thinking like, oh, I didn't know that, or I didn't know that. But their discussion is really going to get them engaged with that thinking. Make a little transition down to objective number 3, and then discuss the risks and benefits. Okay, so we discussed this, but some patients get Lovenox, some patients get heparin. Tell me about that. Who have you guys seen get Lovenox? Who do you guys see get heparin? And then you can talk about that some more. So you can see how just having these objectives gives you that map for a conversation. No 2 conversations will be the same. I know that if I'm teaching this to PGY2s over different years, it's going to look different, but at the end of the day, they're still going to hit on my learning objectives.
Yeah, I'll say with this, I think a nice part of the way that you're organizing it is that if a question comes up during the session, or if it's something you're watching, like a simulation, and you say, hey, we need to address this, you can quickly, you have your list of lily pads, you can quickly add something.
Yeah, you can add the learner.
There's a lot of
learner driven, yeah, absolutely. So you can sketch those in as well, work the conversation, just not even in a sense, a regular small group, if something comes up in conversation. So again, this is kind of what we're following. So a lot of times an active learning activity doesn't have a lot of PowerPoints and things that come with it. They more have an outline or a map that you're going to use. One of the other helpful things with learning objectives is that I can have an activity like this, and I have learning objectives written for 1s and 2s, and learning objectives for 3s and 4s. And then the level of conversation is just going to kind of change with what group I'm in. But you can prepare, many times when I prepare for small groups, I'll prepare for all 4 classes because I sometimes rotate between those, and now next year I don't have to readdress this. So you just make it all at once, and so sometimes maybe I'm only gonna get to 5 learning objectives, but I've written 10 because half of them were for the senior group. Okay, so it also helps to clearly summarize the discussion. You've got this thing in front of you. You can say, today we discussed 1, 2, 3, 4, 5. Great. Do you have any questions? We covered these objectives. It reinforces at the end of the conversation what they were supposed to take away, so they don't leave feeling like they know their friends better, but they don't know what they were supposed to have learned from it. So again, you reinforce what you taught by using those objectives at the end. I just want to take a minute to talk about a couple special challenges with communication. I think right now, I like taking time more to learn the basic learning blocks, but I do want to acknowledge that there are some special circumstances that I think we all encounter quite often. I'm going to address them briefly, but please feel free to talk to your small groups about these. First of all, sensitive topics. I mentioned this during the pre-brief. I would say we've got a lot of examples up here of what people might consider sensitive topics. Again, address these during the pre-brief. Opt-out phrasing, so I never make anybody on any given day, I don't force them to have a conversation they don't want to have. We have to confront so many things on our shifts that I don't think we need to confront them in small groups. But, so opt-out phrasing, I generally will include that. If somebody opts out, please make sure you circle back and touch base with them and make sure that they're okay, or that you address whatever's going on in a way that's going to make them feel supported. Empower learner response, again, you're telling people that it's okay to think and feel what they're thinking and feel, and emphasize confidentiality at the pre-brief and the debrief. Okay, when I say emphasize confidentiality, remember that when you emphasize confidentiality, you also have to follow through. So if somebody is breaking confidentiality in one of these small groups, it is your job as the facilitator to follow through and make sure you follow with that person, or whatever professionalism outcomes or consequences there's going to be. So, for example, I can't, like I said before, I cannot make a safe space for you guys. I do my best. I really, really do my best. I can't guarantee it, because what if Lars is going to go out and share all these stories you guys told? I know. You can't do anything about it. But what you can do is you can tell the group that is, you negotiate a pre-brief, that's not what we're here about, that's not the rules of the game. That would be, breach of confidentiality is going to be something to follow up on, and then you have to actually follow it up, and there has to be consequences. That's one of the ways that you protect all the learners. So, especially on something like this, again, that type of language where you're emphasizing confidentiality. Distressed learners, sometimes people get overwhelmed. This happens in the simulation environment because we are putting people in a mindset that is very stressful, and we do that intentionally with a lot of different bells and whistles and sounds. And so sometimes people become distressed. This can happen during small groups where people are tired, frustrated, hungry. You acknowledge the distress. You can, I always say, normalizing is great because we've all been there. We can all have these emotions. It can all be hard. You offer a break or resources, and then again, remember to follow up with those people. Disengaged learners, the one that's just checked out. Just remember that disengaged does not mean not learning. Engagement looks different on everybody's face. Some of us are programmed to make the eye contact and smile and do all the things that say I am listening, but don't hold it against somebody if that's not what they choose to do. So just know that they are sometimes learning. Carry on, invite them to share perspectives. That's often a real easy way to get people engaged, is to get them to share their perspective. Not necessarily a right or wrong answer, but their perspective or their experience. Cool. Corrective feedback. When somebody says something that's just absolutely not true, you have to correct it. So in a conversation, that's great. We don't want to step on somebody and say, oh, you shouldn't have shared that. But if somebody shares something that is incorrect, you must correct it there as the facilitator. So you can always circle back, make a note of it. I might circle back and say, hey, I want to touch on and clarify something. I heard something that I think I want to make sure we're all on the same page. Let's talk about it. So you can circle back to it. We have an example up here of something called advocacy inquiry statements. Simulation is used this all the time. You can say, I noticed that you said, I'm trying to think something. I noticed that you said that, you omitted etomidate from your RSI meds. I'm concerned that this may result in adequate sedation. I wonder how you see it. And then you get the conversation started that way. But you clearly say what the observation is, what the concern is, why you are concerned, and it's generally your concern about the patient, the impact of the patient, deviation from guidelines, things like that. So again, observation, clearly explaining your concern as the educator, because if they disagree with you, you gotta have a conversation about that, which is really fun. That's that psychological safety. You know, you have to feel comfortable discussing your stuff too. And then like getting them to talk about it. Okay. Oh, and tangential discussions, as you can see with these like, you know, digging, generalizing, conversations can go everywhere and they can spiral out of control and then nobody knows what we're talking about. So you can recognize and redirect. So don't just ignore what somebody's saying, it's a little rude. I mean, their thoughts are working and they're engaging and they're talking and that's everything you want them to do. So you can acknowledge and say, wow, that vacation sounds really, really fun. Well, we're talking about breakfast foods right now, so like let's talk about vacations later. Or yeah, the objective today is to talk about some breakfast foods. Let's do that, and then we can talk about the other. So acknowledging what they're saying like, yeah, that sounds really great. Yeah, that can be meaningful. That's not what we're talking about right now. I like to use and language. Oh, that's very important. I really like that you brought that up. And we're going to return to the learning objectives. Your job again as a facilitator is to keep people around those learning objectives with their conversations. Okay, so those were a couple little things we went through quickly. I believe we're going to have a bit of a break right now. And then what we're going to be talking about for the remainder of our time is, we're going to have 10-minute break. We have 2 more modules. One of them is on the structure that we follow. In simulation education, we follow a debriefing structure. It often is subtle. Once you see it, then watch your debriefers. You're going to be able to see what they're doing, but we're going to introduce you to that structure. And then we're also going to introduce you to a structure that you can use on shift. So again, we talked about the learning objectives, the pre-briefing, how to communicate. Now we're going to talk about the structures that you're going to put those conversations into. Okay, and we got about 10 minutes now, so we'll start again at 5 after.
So it's literally down this
All right, everyone. I think we're going to get back together and go talk about the next topic. So wrap up your conversations in the next minute, maybe. All right. I'm going to stay up here because I don't have the kind of projecting voice that Julie does. I think she wants us to get started, so we'll just do that. We'll keep moving along. Hi, everyone. My name is Charles again. I'm going to be talking about structured debriefing. And I really like kind of where this module lands, because I think it really takes takes some of the stuff that we've already talked about in the last 3 modules, right? The communication piece, the learning objectives, pre-briefing, and kind of uses it in a really structured way. So what we're talking about here is, so first I have no disclosures. These are the learning objectives. I'm not going to really read them out loud, but we're talking about a structured way to guide learning, right, for our students and our residents, et cetera. And so what we're going to do in the next hour or so is I'm going to kind of go through a really quick introduction of kind of the basics of debriefing. And then we're going to watch an exemplar video that shows kind of what I think is the optimal use of debriefing in a educational setting to scaffold a discussion and to guide our learners. And then, we're going to do some debriefing practice. And what's going to happen here is in each of the tables, we'll do a little bit of role play. Some of you will be in the hot seat as the debriefer, and then our facilitators at each table are going to kind of guide you and debrief the debriefing. So what is debriefing and why do we do it? Why do we love to do it? It's a form of reflective practice, and it's really debriefing is a conversation, right, between the facilitator and the learners, and between the learners, that's deliberately facilitated to promote reflection on learning, and that's kind of the foundation of ongoing learning. So in order to learn from any experience, you have to kind of reflect on it, and so and then you attempt to take what you learned in that session and then apply it to your future practice. And so debriefing helps learners evaluate their decisions. You know, not just think about like what they did, what decisions they made, and what mistakes they may have made, but why? Why did they do that? And it helps them kind of dig deeper and kind of develop this sort of like ongoing. It's kind of like thinking about their thinking, right? So this kind of meta, you know, to get to kind of a deeper understanding. When do we debrief? Now, again, we mentioned many of us do simulation, and when we hear debriefing, we think automatically about simulation, but it really can be used after any educational event or experience, and even after a real-life clinical encounter. It's really, I personally think it's a powerful learning tool to kind of get the most out of an experience, to squeeze all the learning out of what just happened. And in order to adequately do a structured debriefing, you need to have a structured setting, sufficient structure, sufficient time, and people in small groups like we all are today to really get the most out of an educational setting. Okay, so I kind of flew through that because I think really the meat of it is this. So how do we debrief? There's no one right way of debriefing. There are a number of published and well established frameworks or structures for debriefing. And it's a good idea when you debrief to use some framework. And not only is it helpful to guide a discussion in debriefing, but I think it just makes it easier for us. I think for all of us who debrief regularly, it almost comes naturally, but it's because we've done this over and over and over again using the structure, right? That, like, in my mind, I don't have to think about the different steps in debriefing because I've done it a bunch of times, and so it's like kind of honed in. It didn't come naturally to me, but now I think I can almost make it seem natural, but in my mind I'm still thinking sometimes okay, I'm in this phase now, I need to do this, and in that phase and do that, and it helps me it helps make my life a little bit easier as a debriefer. So there are three main phases. There's the reactions phase, the analysis phase, and then the summary phase. And you'll kind of, once I go through it, you'll understand what these photos mean. Right now it's just kind of random. So the reactions phase is what you do at the beginning of a debriefing. There's an opportunity for facilitators to reemphasize psychological safety, what we talked about earlier, and to provide learners a chance to express their initial reactions and release the emotions that they built up during the sim. It's kind of this popping this emotional balloon, right? When learners come out of an educational experience, whether it's simulation or after they see a real patient or whatever, there's a lot of just pent-up emotion. Often it's related to, the feeling like, oh, I really missed something there, or I didn't get the diagnosis, or wow, we did such a great job, high fives all around, right? We talked about earlier how after an educational event, a simulation, just as an example, they come out of the sim and there's already a lot of chatter going on. There's all this emotion and swirling around, and the reactions phase is an opportunity for the facilitator to kind of let everyone kind of vent that, whether it's positive or negative, right? So, when I start my reactions phase, I'll say, how did that feel? Or what's going through your mind? You look angry. Tell me more, right? This is not a time to teach. It's a time for the facilitator really just to hear what's going on. And we talked about this earlier. I think Julie mentioned this is learner-driven objectives, right? This is where we learn about what the learner wants to cover, right? We have our learning objectives in front of us, and we want to cover that in the analysis page, which I'll talk about next. But we also then sort of get to kind of change it up a little bit depending on what the learners are focused on. And so the reaction phase is really important, just to kind of get things out in the open.
Can I say one thing?
Yep.
Also, if you're doing a small group on something like a literature article, not as exciting, right? But you can still start that by saying what do you guys think about the article? And people might be like, oh, well, I thought it was interesting, blah, blah, blah. You might just be like, article, 8 a.m. But it allows you to kind of gauge what's going on. So again, that reaction phase lets you kind of know where the group is, but you can use it even for something innocuous.
That's a good point. The analysis phase is really the meat of the debriefing. This is where the facilitator leads a discussion or facilitates a discussion that explores kind of a variety of different performance domains. So, decision making, communication and teamwork, leadership skills, situational awareness, and this is where the learning objectives that we talked about earlier that you've designed beforehand for this educational session. This is where we'll use the learning objectives to kind of guide our discussion, right? Let's say you had 3 learning objectives, and you want to try to cover them in this analysis phase to some extent, in whatever order seems natural to the conversation, but you want to sort of try to tick those off. Now, depending on what you learn in the reactions phase, you may kind of reorder those learning objectives because you're like, the learners really just missed this thing, or there was this big performance gap that I need to really hone in on. And that'll be kind of the highlight of the analysis phase to start up, right? And then you'll learn things along the way based on the discussion that you have and things that are uncovered, the frames that learners come with, or the discussion that that ensues. You will add or subtract to your analysis phase. Now, any debriefing only lasts a finite amount of time. You're not going to be able to cover everything, but you want to hit the high points here. So in the analysis phase, these are just some, and I think in all of your handouts you have this. These are just some tools that you may use in the analysis phase. So having learners perform a self-assessment, asking them what went well and what would you want to change and why. We talked about advocacy inquiry a little bit, kind of the I saw this, I am worried about that, and I wonder, right? So taking something that you observed during the educational session, I noticed that you mentioned this, or I saw that you did that, a very clear observation, and then inquiring about their thought process. Sometimes if you don't know how to frame this, the easiest thing to do is just to say, I saw this, and I want to hear your thoughts. It's meant not to be judgmental. It's like, what were you thinking? You don't need to do that. Just something simple like, yeah, tell me more. Or I want to know, what was your thought process when this happened? Or in this, once in a while you have to do some teaching, as Julie mentioned. If the learners just really miss the mark there, or they have a question that no one is able to answer, this is your opportunity to provide information. But ideally, the analysis phase is a conversation. And in the last module we talked about conversational tactics. This is where you will apply them in this structured debriefing. And then finally, the summary phase is kind of just an opportunity for you to summarize and recap everything, make sure that we hit our learning objectives, to highlight the things that you really want them to take away, right? So recap the high-level take-home points, suggest future learning actions, and really kind of like put the stamp on that learning session. So in simulation, there are a number of debriefing structures that have been published. And really, ultimately, all of them have the same three phases: the reaction, analysis, and summary phase. So boom, boom, boom. They're all different, but they're all the same. And so you don't need to worry about picking one specific one, but just know that these are the three kind of big components of structured debriefing. Now, there are a few models that have a slightly more complex framework, but ultimately they still have the three same things: the reactions phase, the analysis phase, and the summary phase. What we're going to talk about more today and use today in your small groups is this PEARLS structure. And I want to just kind of quickly go through it so that way you're familiar with it. But again, it still has those three phases. It does expand them, and I'm going to go through each of them right now. So the first one is the setting the scene. This is actually kind of like the pre-briefing we talked about earlier, and it's an opportunity for you to set the stage, to establish psychological safety, to reinforce confidentiality, and then to kind of just to set the stage for what's going to happen next. Like, this debriefing is an opportunity for us to discuss the performance of the team, discuss the performance of the system, and not really point fingers at one individual person. You go through the reactions phase, and then one thing they add here is a description. This is really useful in simulation, but also I think in sort of after a clinical encounter, to really just like level set on like what actually happened. Can someone describe the medical aspects of this case? Oftentimes learners, especially junior learners, they kind of get held up on, did I make the right diagnosis? Did I give the right medication? What was going on? Just like what happened here? That's often what happens with even some of my residents. Like they do the right thing. Everyone really wants to know if they did the right thing. And so just kind of having somebody kind of summarize what happened, the medical aspects of the scenario or whatever, it kind of helps them then fully engage in the analysis phase, right? And then we have the summary phase. Questions about that? Yes?
I would just say I often choose the person that I think is the least knowing what the heck just happened, to summarize what just happened, because then the other people fill in, oh no wait, we missed that part, and it doesn't seem like me having to tell them.
That's a good point. Yeah, and really you just want, and really just want to make sure like are we like completely off the mark here, right? And if the summary is very far off, that's an opportunity for the facilitator to say, actually, this was a case of anaphylaxis and not asthma, right? And ultimately it doesn't matter, right? But I think learners really they just get held up on the diagnosis, right? They want to know that I get it right. And when you say, okay, it was this, but we're going to talk about, the approach to an undifferentiated respiratory stress patient, right? That's really what it is, right? The diagnosis often doesn't matter, but you need to move beyond that. Otherwise, they won't fully kind of engage in the discussion.
Well, yeah, if you don't have a shared mental model, that person that thought it was asthma when it's anaphylaxis, they might not be sure, so they're not going to say anything until they know that they're not going to say something silly. So it gives you that shared platform.
Yep.
Yeah.
All right, so in the next 10 minutes, we're going to kind of watch a video together that I think is a good example of a kind of a high quality debriefing. Now, this is just one way of doing it, but it does use the Pearls framework. I'm going to start and stop and kind of point out the different sort of phases. So as we start first of all, this was created by folks at Kaiser Permanente Central Valley. So thank you for creating this video. We've used it a number of times now. And so this is a video that is about 3 minutes long, and the facilitator is leading a learner group through a debriefing after a cardiac arrest simulation. So you'll see the facilitator use the Pearls debriefing structure. And so as we start the video, the facilitator is going to set the scene. All right, so let me know if it's too loud.
All right, nice.
It's pretty loud. You guys okay? Give me 1 second. All right. So, all right, let's see if that's better.
Good job, everybody. Let's take the next few minutes and kind of just debrief after that case. Kind of as a roadmap of where we're going with this debrief, let's start off with hearing some of your reactions. I want to get some of your emotions and feelings about what happened. Then we'll recap the main steps of the case. We'll analyze, kind of the case and highlight some of the actions that we're taking and some of your thought processes and decision making behind what you guys did. And then we'll follow it up by summarizing and doing some take-home points. Cool? All right, again, I wanted to just, reiterate something that we always talk about in SIM, right? Everybody here is in a safe space. What we talk about here stays here, right? All we ask is that you do the best for the patient that's in front of you, right? All right.
All right. Thank you for that suggestion. Full screen is better. So that was setting the scene. And so the goal here is for the facilitator to reinforce psychological safety. And I think Julie brought this up, it is, safe space is a term that's thrown around a lot in simulation. And I think it's okay to use, but realize that this is not, it's like a space to be a little bit unsafe, right? That's really what simulation is. It's like an opportunity, it's a space to try out new things, to stretch yourself beyond. So I think find your terminology. I think if learners mostly understand it, but I think sometimes safe space means you can do, it's like we're going to coddle you, and that's not really what we're trying to do here.
Don't just say it. You gotta actually build the framework so that you are building that space. And your intention is to build a safe space. It's more just, don't just tell somebody they're in a safe space.
But this is an opportunity for, it's just kind of a reminder of what to expect in the next few minutes of debriefing. What are we going to do in the next 20, 30 minutes when we debrief this simulation, right? All right, so now we're going to have, the facilitator is going to explore the learner's initial reactions.
Let's get some one-word impressions on how you felt.
Okay. Stressed. Great.
Wow, that's kind of a broad range of reactions. Does anybody else want to share your feelings about the case?
I thought that was a pretty classic case of cardiac arrest, but as always, there's always stuff to improve on.
It's been a while since my last code, so I felt a little bit rusty.
Yeah, thanks for sharing this. That's exactly why we practiced, right? This sim kind of gives you a more recent code to reflect and learn from.
All right, so this was the reactions phase, right? And we really just want to pop that emotional balloon, right? We talked about that, where the learners are just sharing their initial thoughts. Now, I will say that I don't do it the same way as this facilitator, and there is not one right way of doing it, but just kind of as you do more of this, think about how you want to kind of get people to talk, to express those initial reactions. And I'm curious to hear kind of the other facilitators, how you approach this reactions phase. Do you guys do it this way or
For SIM,
differently?
I try to ride the wave of whatever emotions are coming out of the SIM. So if everybody's chattering, you just kind of join in to the chatter, and then I make sure that I've kind of heard from everybody. And one of the other really important things with the reaction, if people have all said something, they're more likely to start talking in the debrief if the first time they talk isn't like a share. So if you just get them to say like, yeah, it was hard, they're more likely to keep talking. But yeah, that's how I do it.
I tend to sort of listen, and if I have some objectives in my mind that I think need to be addressed, and somebody says, oh, I think it was difficult, then I'll say, oh, I know what they're going to be talking about, so I usually will jump to that person. But if I think it overall went pretty well, sometimes I'll kind of skip over the people who maybe struggled and focus on somebody who said, oh, I thought it went smoothly, so we can emphasize those points and obviously get back to the people who struggled with it. But I think it just depends where my mindset is and kind of what I can predict where the conversation will go depending on what I'm calling.
Yeah. I think regardless of how you do it, just make sure you do it, because this is really important for them to kind of express initial thoughts and reactions so that they can actually focus on the reflective learning, the analysis phase, the kind of the meat of it. If they are, like, if they still have this sort of pent up kind of feeling that they haven't like let out, they're not going to be able to focus. They're just going to be thinking about, oh, I really screwed this up, or I really, whatever. So let them share that. It is. I do agree that with Julia that I would like everyone to speak. I don't force everybody to, but I try to do it in a way that kind of like expects them to say something. The way I do it is I say like I like to go around and kind of hear from everyone, and I kind of use my hand like any first reactions. And so just by some of the non kind of verbal communication, eye contact, kind of get everyone to say something. Sorry, I saw a hand.
I have a question. So it's, this is for a simulation encounter, but say you're trying to debrief after a difficult case clinically, and then some people understandably aren't ready to move past this phase. So how do you address that? You know what I mean? Like, do you just table the rest of the discussion? Do you try to move people through this phase? I'm just curious what strategies you have. My question is even clearer. Do you know what I mean?
Any thoughts from?
You mean like a difficult?
It's a difficult clinical scenario
That is like emotionally activating.
Yeah.
They might not be able to move past that at that moment. But I do think I think the mistake is jumping over and not acknowledging the emotions, because then that person is just going to be feeling their feelings and they're not focusing on the conversation. So I think that by even in that, like allowing them to express that, and if you can't move on to the discussion, then making a plan for when you could. But I think you're allowing space for that. Yeah, I don't know, Mike, do you have?
Yeah, I agree. Although, we're going to get to that content of actually applying some of these principles on shift. But again, that's more of the objective, constructive, reflective stuff. What we talk about stress debriefing, that's a whole other taxonomy of debriefing, which I agree with Julie. Sometimes you just set the clock in and then circle back to it or consider other resources if it is emotionally activating.
Lars, sorry.
Alex Croft, actually, who's one of our, who's part of the SIM Academy, he's talking about layering those emotionally activating scenarios. Again, as it applies to simulation rather than on shift, but certain techniques for engaging that. I don't know if he's presented.
Yeah, and if somebody if they can't get over, that's not get over it, but if they can't emotionally rein in, that also is potentially a moment for teaching on how to deal with these very real parts of our job. So you might be getting another learning need from them.
I mean, I think, we just have a pediatric death, right? Because that's not the time to start going into look at the numbers better.
Yeah.
No one's hearing that, right? So you have to acknowledge that and not use your own sort of emotional intelligence to recognize those sort of extreme situations. Like, we're not going to get to this today, but make some sort of plan of perhaps reviewing it in the future. I think the sort of pop the balloon, the emotion stage, is so important. This is where you start to build that trust of a safe space, right? I think people sort of express things. It's very important to sort of normalize those reactions to it and really sort of bring that sort of level down, invite people to the conversation. And it's so important to include everybody, because sometimes it's the silent person that really need to help. So normalize and invite them to the conversation. If that makes sense.
And I think we use the term debriefing kind of to discuss like the educational debriefing and then also the clinical, like post very stressful event debriefing. I think of them as very separate things. I try not to do both of those. After a death or a really traumatic event, like the debriefing is mainly just kind of like to let everybody express their emotions, to kind of, give hugs and high fives all around, and not necessarily do any teaching. And then sort of for educational debriefing, we try to keep those. I try to keep those separate because I think everyone agrees that it's hard. Sometimes it's hard to get beyond some of those really emotional cases, and I don't know that anyone's really in a space to really learn. But it's a great question. Sometimes you think that this is just like a regular educational debriefing, and you kind of get surprised, and I think you kind of have to pivot or just feel it out and see if you can still teach anything at that point. Go ahead.
I think this is kind of been said, but validating whatever surprise emotion. If you really are in a situation where you think you need to move on because 9 other people need to get to the educational part, but the one person is stuck on whatever emotional relevance is, present in their own life. I think the key is you are going to have to move on in that situation. Circling back with that individual is key, but also validating the heck out of them before moving on with the group is probably how to strategize.
That's a great point. All right, so next we're going to see the description phase is where I mentioned that this is where they kind of level set and say, hey, these are the medical aspects of the case.
All right, let's get started on recapping this case. Doc, do you want to go ahead and lead us through a summarization?
Yeah, I thought this was a pretty straightforward VFib arrest with a STEMI patient. We gave epinephrine, amiodarone, shocked the total 3 times. We got the patient back. Then we sent her to the cath lab.
Great. Anybody else in the group have anything else, any additional thoughts?
No, I agree.
Yeah, I would say that's a great summary.
Cool.
All right, so the goal here is kind of to get everybody on the same page about the events that occurred so the learners can have a shared mental model to work with when they actually discuss the things you want to cover in the next phase. So the next phase is the analysis phase. Again, this is the meat of the debriefing. It's where the facilitator will begin to kind of guide the learners through a reflection of what happened and identify performance gaps, kind of uncover frames to get kind of a shared understanding and also to engage them in discussion, kind of using some of those communication tools we talked about in the last module.
All right, so I saw a lot happening in this case, and I'm really interested in hearing some of your thoughts from the group. What are the things that you felt went well, and what are some of the things that could have gone differently?
Well, we got the patient back, so that was pretty good.
I did make a mistake with the meds, though.
Yeah, actually, I'd love to talk about that a little bit more. So I noticed that amiodarone was ordered, and I think given, but there really was no readback from the medication nurse about the dose or the medication that was given. And I'm worried that it might have resulted in maybe the incorrect medication that was administered and could have harmed the patient. How do you guys see it?
I'm actually really glad you brought that up. That bothered me a lot too. I heard an A word and just assumed it was adenosine because I treated a patient with SVT pretty recently.
Yeah, I mean, this could be something that could happen in real life, right?
Yeah, I've actually seen somebody get fentanyl instead of phenylephrine in a code situation. And I think it's just because codes are often pretty confusing, communication is difficult, there's a lot going on, a lot of noises, and so things just kind of get a little cumbersome.
Yeah, great point. Let's talk more about communication. Is everybody familiar with closed loop communication? Great. What does closed loop communication look like, and why do you think it's underutilized in the real world?
So, I think when I watch this, I'm like, wow, that was just like a really natural conversation. Like, they kind of flowed, people talked. But actually, she used a number of the tools that we talked about, right? The clarifying, the digging. We talked about, kind of in the sort of we call it plus delta, but it's like, what went well and what could you have done differently? She also used advocacy inquiry. I noticed this happened and I'm worried about this and I'm wondering what she used a lot of different things. And then she also said, like, what do others think, right? So kind of having the other members of the group speak up. So you can see how, you can really kind of just pepper some of these tools and skills into your debriefing, and it kind of really generates a much richer discussion and conversation. That's what you want ultimately as a facilitator. I can tell if I'm doing a good job by just how much I'm speaking in the analysis phase. If I'm spending most of the time talking and the learners are quiet, I'm not using these tools effectively, or I'm not using them at all. But if I'm doing it well, I can just sort of sit back, kind of, just cross my arms, or just, I'll put my hands on my lap and say very little, and the conversation just kind of flows by itself. All right, so finally we're going to see the summary phase, where the learners get to apply their knowledge or apply what they've learned and kind of discuss how they would sort of use that in their clinical practice.
All right, great conversation, everybody. So the main takeaway points are the importance of closed-loop communication, right? And speaking up and asking questions when something just feels off or something feels different. And any other take-home points you guys can think of? All right, nice work. Let's move on.
All right, so here, this was like a facilitator-led summary phase. She kind of just summarized what was discussed. That is one approach. It is not the only approach. You can also have the learners each share a learning point, or, and so just think about how you would want to, depending on how the learners, how engaged learners are, or how much they still have to say, maybe, you can sort of decide, or how much time you have, you can decide how you want to structure this summary phase. All right. So next we're going to play a game, and it's a group activity, but hopefully it's fun. And so we're gonna role play kind of a debriefing scenario, and it's at each of the tables, the facilitators are going to introduce you to the game, and then one of you is going to be assigned or voluntold to be a debriefer, and the rest of you will be kind of the students or the learners. And so what we'll do is we'll take 3 minutes to play this game, and then afterward the debriefer will huddle with the facilitator at the table to discuss what they want to debrief or how they want to debrief, and then they'll engage in maybe a 5-minute debriefing, and then the facilitators at the tables will then debrief the debriefers. Now, we're all here and having a good time, but we're going to add a little competition to it. So there are 3 tables, and the game will involve the construction of something, and we'll see who wins at the end. That's all I'll say. I don't have a prize. It's really just bragging rights, but hopefully it's a lot of fun. All right.
Well, we could make a ribbon because we've got it.
There we go.
Trophy sword.
Trophy ribbon. Yeah. There we go.
Group size.
Go for it.
Yeah, so just at the tables, team leaders, if you could kind of go over what the game's going to be, and make sure that you pick your debriefer, and then we'll let you know when to start.
All right.
Materials on the table. Longest paper chain if you can, and then just every group have a debriefer. Yes, okay, and then the debriefer model, what you're going to be debriefing is your group's ability to utilize teamwork skills to make this thing. Okay, so starting in 3, 2, 1, you have 2 minutes, longest chain possible.
One thing that I noticed in this activity is very clear. One thing I noticed is like once the start going jumped into your tasks, I wonder how it felt when you guys just said the phrase that go and just start.
Organized to figure out what's going to be real matching, like focus on
Did you feel that immediately, or did your perspective change?
within a few seconds, I think we should where do you think that what we do is really needed? And we all kind of felt
Did anything take long to your bed?
Ribbon can take that's not giving
You feel like prohibited?
I think we kind of then once you got all these now we got we've got 20 seconds left. Like when you go to
Right. One of the things is there wasn't a lot of time.
Yeah, I think
that's
that's
part of but as is for the longer, more drawn out activity. Would you guys like have more like intermediate indicators of success with the like instead of A, maybe it's
Making more search that would be assembled.
We would have analyzed
Scripts that you want to take, but there's only 12
they're right.
So, and we talk about really taking my plan was to be adapted.
These machines.
He used to call that like a keeping track of time. And I kind of think like how ironic it would have been is where in a situation, we have a bunch of small changes and all you needed to do is just put them together. So in clinical practice, I would be worried if this like real world, really big competition would make it. Very modifiable event doesn't happen. Very small aspect of that was communicated. So if you guys are doing this
one year to be watching the
Because I thought one big, long figure that you
Yes.
all
together.
together.
I think that's very insightful.
And I watching it, I wasn't just like have a timekeeper, because I think only 2 minutes and more hands needed, maybe they bootstrap.
Oh, okay.
I would just set like a 90-second timer.
How do you guys
that
feel
go off. So,
organized?
if I have to do the action, it would remind me, so that's something that I would do.
That's what all volunteered for a certain
Is there anything about this activity that I can talk about that you have to give information for you?
We need like longer tape.
Yes. If I was gonna do it again, we kind of had like 2 months, you know what I mean? So maybe communication, like, hey, really have to do it versus working on the video, was actually stats or something.
Yes.
Yeah, like
Voice to
strategy.
make the longest chain, I'm asking like this deep use of color strategy or certain way
Yeah.
that the rules of the game.
How do you guys feel for mindset? Yeah. Having your hands all get the items ready. And feel about it. Yeah. So we had a shared goal. I did notice there was a lot of positive statements.
So, to summarize, you guys were given the task of making the longest chain possible.
we had
I think this is a great example of a type of task. A lot of time, once, some times when there's a time.
What are some of the things that
so much fitting in, let important words kind of go by the wayside, like communications and.
Very good.
I think this would be a good example of type of activity where it's how important it is to recenter the previous sample.
Supply chains.
I think that's
When you, yeah, when you
we jumped in without thinking about what
it is.
Okay, so we're gonna
was envisioning, like, if I posed that type of question to my students, and sometimes when you but I didn't
So, yeah, that's kind of like the Now I know that I'm going to teach them things. Now I can be like, okay, distraction should work and it distracted me. Now teaching is like back on massive program issues. How do you do this? I had a little hard time finding this actually how we not
I think we're like, you don't want to waste any time. The only dynamics are the things that just to be removed that is like what actually happens. It's always doing this scenario.
And honestly, every time you do get a little into that, it's usually great for people to learn it. So I was and not because I actually think that's where you're going to be having a really great class. You're going to discover new things that people are not seeing. And that's
facilitating discussion, and as long as like you're coming as a discussion from a place of genuine curiosity, then you're fine, right? So I think one thing we sort of was like feel that sort of urge to like do something about what somebody else thinks. That you pose questions that you actually like or you guys you like respond to you're just facilitating a discussion, and a lot of times within the learning group, they will come together without having sometimes you by facilitating by uncovering the learning, where you're sort of like starting curious, right? And even if you don't know how to start by just being genuinely curious, it's a nice I believe it's some questions that generate a session that get or but a lot of times you sit back and you say, if you start with like, you have a question and one person needs a response, you just say, oh, this is really right. You just put it right back to them, right? Rather than saying like, I need to do something. Yeah, this is great. The goal is to not say anything that's not. It doesn't always work. Actually, the initial comments,
Yeah, I think it's trying to focus on what I said already. I am interested in a great conversation that these people are going to have. I'm not really a part of it. I'm just facilitating them. And so that's like, I'm really focused on like, I'm interested in what they're going to say. Now I'm getting one, because I graduated from university 2 years ago, so now I'm generationally like a generation different. I'm actually really interested in what people are thinking. This now, this, I feel like it's a part of somebody got to like, I do know it's
in reality, that was the contributed towards success. They're talking about our policy on that. Because that will go back to like,
It's like, that's that reaction.
Oh, don't worry. There's nothing. This is special. I'm just telling you, you gotta use it.
Okay, oh, sorry. Okay, so we talked about the PEARLS methodology is very well used and loved by simulationists after SIM. You can also, I use the PEARLS methodology when I'm in a small group. It's how I move kind of through my small groups if I'm discussing an article or some problem-based learning. But that's a little, the structure can be a little bit cumbersome after something like a shift. So we wanted to give you a different structure, the SPED structure that you can use for clinical debriefing. It's going to incorporate a lot of the things we said, that it has just a little bit more focus on the clinical area since we all educate in that area. So take it away.
Great. I'm going to try and stay around you guys.
Yeah, I like that.
But I might have to reference those back there. Right, so what Judy said, most of these strategies that we talked about, tools that we've given you, and is the context within the classroom or the simulation lab. And so we want this next session, or this next module, we're going to talk about how we move these same tools, or apply these same tools to the clinical space. A lot of the work that we do is with residents, with patients, or between patients. But a lot of the same tools and facilitation can be applied there. Our objectives will talk about a little bit about clinical feedback and coaching, distinguish those two, and then apply this through this framework that we'll introduce to you. You might be already familiar with it from your background. There's an SPED model, how to deliver feedback and facilitate it with this clinical coaching orientation. And then we're going to do the practice of another role-playing exercise that we prepared for you clinical facilitated tables. And I think part of this too, this might come up in the small groups, but addressing some of the obstacles in delivering feedback on shift with everything else that's going on while we're caring for patients. So we're going to bring it back again to the Kolb cycle, experiential learning. Often in our simulation sessions, we put a lot of thought behind it to create this concrete experience, to create a scenario that's relevant, objectives, and in order to do that, to look for the observations that we're anticipating our learners to perform during that session. When we're on shift, however, the concrete experience becomes that experience with the patient, or the shift in general, or the procedure that you perform with the resident. And so it requires a little more attention as the supervisor, as the faculty, to the little nuances, those observations that you'll have during the shift. So that's just to say it's all the same as applies to the clinical setting. You just might have to have some attention to that clinical, to the experiences, and which ones are going to be most ideal in order to promote reflective learning and improve performance with the resident that you're working with. So what are the principles of clinical coach? I know there's been some differentiation here. I think the way that I look at it is just how would you become a simulation facilitator on shift. Feedback is always going to be there. That's like the objective observations that you have, but the way that you manage that delivery of feedback in order to promote reflection really, I think, differentiates you from just someone who giving didactic information versus someone that's facilitating continued growth of your learners and focusing on those future outcomes. here we, it's differentiated a little more. And feedback, more like reactive, looking back, the more didactic. It's often unidirectional, whereas the coaching dynamic is often bidirectional conversation. You want to get them to self-reflect from the start, and then it's goal-oriented. So it becomes your role in facilitating the future SMART objectives. Again, the objectives we talked about earlier. But the SMART objectives so that they can continue that experiential learning process on shift or in the simulation lab, wherever that may be. So this is an SFED model. There's a lot of different frameworks. I'm not going to promote this as being the best. There's R2, C2, some maybe a gap model.
A lot of them are similar too.
Just like Charles mentioned, is like there's beginning, a middle, and then like every story. There's a reaction, analysis, and summary. And that's, I would say, true here. And this is even like conceptualizes this ask, tell, ask, or like the dynamic itself, you the learner. So starting off self-assessment, we start off there because we want to understand their pain. We want to understand their learning. Just like that reaction phase. I think it might also get into a little bit of the analysis too. And also may require some of those communication strategies that we talked about earlier, because a lot of times the responses are like, we're good, but we're good. All right, tell me a little bit more about it. You might have to be a little bit more direct. You might have to be, okay, let's like focus on this part of the shift or this procedure or this dynamic, so that you can orient them to some aspect, again, some concrete experience that they can start to self-assess, and then you can follow the conversation there. There's still going to be some degree of feedback, some objective, telling of information, and sharing of how you perceive that to have an impact here, impact on the patients. And then the last part is another ask, so directions, or circling back to this learning. So what are you going to do next? And this, again, of course, a little bit of finesse of you as a facilitator. It is that summary, it is like those takeaways potentially, but it's also, again, future goal setting. How can you leverage what you learned from, this experience to future experiences? And again, it's, we talked about so much just like with our objectives. It's more about the precision, in creating results rather than the volume. And I would say too, even with the feedback, more about precisely talking about your objective observations than like randomly so quality over quantity, I think that's for these.
Choose your battles.
Yeah. And encouragement, I didn't mean to skip over that. I think we talked about psychological safety as a portion. I still think it can be asynchronous. It can be a through line through your interactions. I think we, just submit that like even providing feedback is going to have greater impact or be more credible if you have some rapport with the learner or some continuity. So it's just to say there's probably some stuff you can do in the moment to facilitate a conversation and be encouraging and again, help at least foster a productive conversation that will be impactful for your learner.
Just thinking, reflecting, is there any nuance in regards to the generational gap? I was just thinking, I saw you talk. Yeah,
Well, yeah, I guess.
Like,
tell me more about that.
Yes. So as a respiratory therapist that onboards our new staff, inherently they're the traditional learner, high school, college, workforce.
Yeah.
We have others that are maybe a second or third career. Mm-hmm. They have a very different lens on what the expectations are, and full charge ahead. And others are what I call those workers that are looking for that ribbon, always seeking that acknowledgement and good job. And we had the polar ends like, do your job.
Yeah.
So
They respond more to that. They respond more to, or some people want a little more encouragement.
yes,
So
half the battle. Everything you do, tell me what I need to learn. Well, here's the policy and procedures.
Here's your didactic, here's your online curriculum, here's your labs. We're here to help you navigate your onboarding process. So I was just reflecting on, I'm the aspect's new to me. So I was just like, wow, this can be helpful, but also equally very challenging, knowing that we have a change in the workforce dynamics, at least with the straight therapy across the U.S.
They're almost a generation now.
I think the sort of Gen Z is very much, this is the sort of feedback they love, right? They've grown up with internet resources, and they don't have very little knowledge of the application of, well, on shift, in the actual work environment, this stuff becomes really helpful, and the act is very well received by the point.
Yeah, I'd also say the self-assessment right at the beginning becomes so important because I'm in the position where like I was talking about I'm 10 years out of residency, so I'm finally like now feeling like I'm a full generation away from my PGY ones for the most part. So sometimes I don't know what they're going to say in the self-assessment. I really am approaching it with genuine curiosity. I'm like, how do you think that way? And so I think it does center their perspective, which is going to be valuable for that group. I have books I can tell you to read also. I'm reading so many right now but about this specifically. But the self-assessment is going to center that. The encouragement, it being like an entire letter in this SFED model, they do want the encouragement in you to say like, you got this, keep working at it, this is your pathway forward. I for the encouragement, the basic assumption, you're intelligent, capable, care about doing your best and want to improve. And so there are ways of doing these things where it isn't coddling. And I think that sometimes people make the mistake of falling into like coddling because it is so similar to what they need, but it isn't really the same. So appropriately challenging. And setting those high standards with the high psychological safety is what's really, really important there.
Yeah, and we were just kind of, as we finished the last one at this table, talking about that issue of like when positive feedback is helpful and when it can kind of derail things. Like if that's what people learn want, it can sometimes end the conversation prematurely if you give it prematurely without letting the discussion blossom.
Yeah.
And I was one of those things that I find myself doing because they want it, I want to give it. And we end up there sometimes when nothing else is happening, but your job is to make something else happen. So,
yeah.
But at the same time, be supportive,
Yeah, but I think you can respectfully say that they like didn't achieve what you wanted them to achieve, and be very clear and set high expectations and be clear, and then provide that encouragement. And I also feel like a lot of the language we're teaching you gives you a professional language, so it sounds less like it's coming from me, Julie, the person that hangs out with them and goes to happy hour with them, and it sounds more like me, Julie, the simulation engineer, when I'm using that sort of language as well. So I do think that I also try to remember that successive generations have more and more and more resources available to them. So I use the example of like Gen X, they got from Tintinelli or whatever textbook, and it's like read and learn this. Now you have podcasts, you have all this stuff, so you do need a little bit more affirmative encouragement and confirmation when you're on the right path, because there are thousands of paths. So I also try to remember that some of the acknowledgement that's needed is because of the different learning environment. Yeah.
Learner buy-in with you, and sometimes this is the time to do it. Or sometimes you might have to put that into your pre-brief where hey, like I have a couple minutes before where I talk about a difficult case where this is why you need to know the case. I was once in a situation where this happened, so we have to find the right time to get it right, depending on if it's more discussion based, if it's lecture based, but finding the right time to do that and everything to show everybody live.
Yeah, and also, say that, we talked about this sort of towards the end of this shift, but we had discussions earlier, and people have shared, it's like often, it's also important to then, at the next shift, to engage the learners, that this is a conversation that you want to have, and then like set the intention, because, I guess we'll move on to, well, not the exercise, but these like barriers with like time and engagement, the encouragement helps the buy-in, and kind of previewing that this is something that you want to do and you want to create a habit, and invite them along early in the interaction or in the dynamics, whatever composes your interaction with the learner, and value because there are so many things that we, from the perspective of like an EM shift, that can get in the way, the time, the cognitive load. Often, and it could be just like learning engagement in general, or they could feel like, okay, why are we having this conversation? What did I do wrong? Rather than facilitating this. It's like a man or two promote their reflection. That's really helpful. And it's real promote clinical reflection among your learners.
And you can normalize it in your pre-brief to say, at the end of the shift, we will be having a feedback conversation about things that happened today, like we, just so that they expect that. And they know that I'm pushing.
Exactly. All right. So we'll jump into the last little activity here. Essentially, it's to like it's set up as a role play. You have on the back page. You have this like aesthetic infographic, or like back of the whole packet that you can reference. But we then also set up small little vignettes or observations for feedback that you have to agree on in these tables. The idea is like one person will choose, you as the like person who facilitated the feedback on shift, faculty, let's say, will choose one of those vignettes as something you observed among the learners. You will share that with one of your participating course facilitators. Say, this is the one I'm going to give you feedback on. And then you're going to apply that as a framework to conduct a conversation and do a little bit of role play. And then you can debrief it afterwards, see how it felt, things that you want to work on, or things you felt some like friction points with. And then kind of go around, and people can also say that change goals.
15 minutes?
Yep.
Yep, let's do it.
Okay.
Okay, so we're going to get into some little Yep.
We have friends.
Do you want me to actually
We'll have
Okay. Yeah, I can be your. Here, let's look at so this is just a little role play. time slot. I was like, well, that's the death of this workshop. But you guys are here and I'm so happy and it really makes my heart full of joy. Thank you so much. We're all here to help you. Anybody that is a part of this group as a facilitator, please feel free. We're here for you. We can provide mentorship. My email address is up there and I'm able to get you guys anybody else's contact information if you need. They always get feedback from any of these workshops. So if you think something was great, please say it. If you think something could be changed to make us even better, please say it, because feedback, is so important for things to remain relevant and well designed. And we really thank you so much. And with that, we'll just we're done with the workshop portion. Like I said, feel free to hang around. We're going to answer questions. Thank you guys for all participating. Oh, and if anybody has any other questions, I guess we didn't do big group questions. Does anybody have any burning questions that they feel like, yes, sorry, I let you go and then I held you back?
No, it's all right.
Yeah. Yes, any questions?
How do you reframe prior to the simulation where they're blatantly, I hate SAEM, and they come with that mindset where everything's going to be toxic? But welcome to our institution, because we embrace the SIM in all flavors across many different disciplines. So how do you have that adult conversation, trying to convince someone who's very adamant that the situation they're in is truly a positive?
Yes, and this is also for like tabletop games or role playing, because a lot of times people do not want to engage with that for many different reasons. I'm going to open this up to some of the other facilitators, because we all have that one person every couple of years that's just like, I hate it. I'll open up to you. How do you guys engage them? I have thoughts, but I know you guys also have strategies.
And not at the same time as you're engaging in a group. So, if it's like a single person who use their head to do something with them on the side, say, hey, what don't you like about this? Showing the importance of it. But, in a group setting, it's probably, it's tangential, it gets off topic. So, getting
Yeah, you just dug there. You just dug in with that tool that we were talking about. Tell me more. What do you not like about it? I'd say 95% of the time they say, I feel very uncomfortable.
Or being judged, you're watching me.
And I say, I am judging you. You're absolutely right. Your instincts are dead on. And that's why we're going to have confidentiality, and we're going to build your psychological safety. And you might not get totally over the hurdle with that person on that day. So consistency is really, really important. Lawrence, did you have a thought? No, or an awful face?
Yeah, I think, it's exactly that, really sort of reassuring. I mean, building that, it goes back to that psychological safety, building that safe space. It's not like the act of saying it once, it's a kind of theme, it's kind of what you bring to every educational space, repeating it. And sometimes that small talk before a shift kind of encourages that kind of stuff that, that small talk creates sort of alliances between you and your learner, and then in there you can put in the why. Why this is important for learning these the high stakes, low frequency things that we go through every day with the course we know how to do.
Yeah.
But finding out the specific reasons, I think is super important.
And sometimes having a conversation in front of other people might be helpful, because they might have the same feelings. A last thing I like to do, and this has worked very well in some of in some different contexts where people are like, oh, this is for children, these are games. Well, I'll remind them that like NASA and the Air Force and high-performing people with technical jobs do simulation, and it's part of what you do to train. And we are also high-performing technical, and this is a way that we engage to learn. So I do try to professionalize it a bit, and that their engagement and them putting themselves out despite being so uncomfortable is an important skill to learn, because you're going to be uncomfortable in the clinical area. So
I used to think it was me, like I didn't create a big sim or a big experience, but
it's not.
Thank you. But I think that learners just learn differently. Some people are just not engaged in kind of learning educational modality.
Yeah, that's
some people just don't like to listen to lectures. Some people don't like to read textbooks. Some people really love podcasts, others don't. And sim, I think, is just any one modality of learning. That they just don't sort of. But I think it's rare that learners don't respond well to sim when when they're told like this is integral to kind of how you train, and I'm going to watch you on your clinical shift, and this
I feel like that's much higher stakes than in a simulated setting. And so, this is your opportunity to really going back to that sort of basic assumption that learners are here to do better. I think when you say that out loud to a learner, they really engage more because you're saying, you're sort of saying like, I'm giving you this sort of like, you're setting an expectation for this. You're sort of, it's like, you're creating a psychological safe space, but when I say that, I'm also saying like, I'm holding to a very high standard. And so I hold myself to a high standard when I create these educational, sessions, but I'm holding you to a high standard to perform well.
Yeah.
I think there's sometimes like educational creep too that happens like groupthink, where if one person really gets rolling, they can kind of contaminate others with these thoughts. I do also think that there's sometimes multiple people leading the Sims throughout the year, so sometimes the reliability of the safe space gets dissipated a little bit, and so I make it a practice annually to sort of do it, and this is why we do Sim, part of the first Sim sometime, and kind of really double down on those, the safe space part of it and the contract, but also some of the like physiologic scientific data of why we do this. Like, if your cortisol levels go up because you're simulating an actual environment, your memory is going to get burned into you better. So it's worth doing when you're creating this experience you may not have for 15 years in a clinical setting, and you need that. So we're doing it kind of
stress inoculation. Yes. So when I talk about stress inoculation, are you going to feel this way in the clinical area? Yes. You need to learn how to deal with that. So this is an opportunity for you to feel discomfort and dissatisfaction and still move through the educational activity.
Well, maybe not every